Osteoarthritis by Tylee Cooper, Sidney King, and Juan Robledo. What is osteoarthritis? Arthritis simply means joint inflammation. In horses, several types of arthritis can occur, with causes ranging from infection to age and years of athletic use. It is a chronic, progressive, painful degeneration of the cartilage lining the end of the long bones inside the joints. Main clinical signs. The three main clinical signs of osteoarthritis are heat, pain, and swelling on the affected joint. There is also an increased production and a decrease in viscosity of the synovial fluid. Because of the amount of pain and the poor viscosity of the synovial fluid, there is a reduced range of motion in the joint. Lameness may be minor to begin with, then worsen as the disease progresses. Swelling causes tension in the joint capsule, so it will start pulling the attachment of the periosteum and there will be formation of bony lumps. And the horse may refuse to perform certain activities, such as jumping, spinning, or stopping.
Okay, this is Shiloh. She's 11 years old and she is a trained barrel racing horse. She's been to the National High School Finals 3 times and she has rodeoed down in Texas. We're going to use her in our video today. Arthritis can be caused by a number of factors. Infection can cause chronic inflammation, which can lead to osteoarthritis. Overuse and athletic trauma can result in joint instability or joint injuries, which will in turn damage the articular cartilage of the bone. Injecting joints to help with joint inflammation has become very popular in the equine industry. However, injecting these joints can lead to infection or worsen the problem with the inflammation, which both can lead to osteoarthritis. Just like in humans, the normal aging process can cause a breakdown of the articular cartilage in the joints and also lead to osteoarthritis. Osteochondritis is a condition where the bone underneath the articular cartilage fails to mineralize. This can cause a damage of the articular cartilage and result in osteoarthritis in the joint. Any horse can be diagnosed with this disease, however, it is more common in older horses or horses with an athletic lifestyle. Horses used for jumping, racing, reining, or any high-impact sport are very commonly diagnosed with osteoarthritis in their weight-bearing joints. The most common joints diagnosed with osteoarthritis would be your stifle, your hocks, and your fetlocks. However, any joint can really be diagnosed with this disease. Osteoarthritis is a very common disease in the equine industry. Data shows that more than 60% of equine lameness is correlated with osteoarthritis.
Here are some differences and changes to a horse's body when they have osteoarthritis, or as it was formerly known, degenerative joint disease. One thing you will recognize if your horse has osteoarthritis is crepitus, which can be the grinding, crackling, or clicking sound coming from the area of the affected joint. The main body sign if a horse has osteoarthritis will be pain. The main way to gauge pain will be the horse showing lameness or stiffness. The horse will present 2 types of pain when they have osteoarthritis. The first being nociceptive pain, which is caused by the activation of pain receptors in the joint as well as abnormal movements associated with the area that has osteoarthritis. The second type of pain is inflammatory pain, resulting from the release of inflammatory mediators that impact a variety of surrounding joint tissues. Inflammatory mediators can also engage the nociceptive pain receptors in joint tissues, making them more sensitive than normal and increasing pain levels. You may notice your horse also gaining the habit of hollowing out their back and raising their head while they are in this pain. Overweight horses will suffer more, so be sure to keep your horse in good health when they have osteoarthritis and keep all extra weight off of the back of the horse to decrease stress on the area with osteoarthritis, while keeping them fit at the same time.